Welcome! I'm Jan Marini, the founder of Jan Marini Skin Research, and I am here with Kari. Kari is actually a nurse, and she's here for her consultation.
Yes.
So Kari, if there was something you could change or improve about your skin, what would it be?
Oh my goodness, I would probably say the sagging
Okay.
and the fine lines and hydration.
Okay. So by hydration, do you feel like you're dry?
Yes.
Anything else you'd like to change or improve? Anything like discoloration, or are you happy with texture, pore size, that type of thing?
Probably texture.
Okay.
Yes, that's definitely. Pore size, I'm okay with my pore size because I think of the photofacials.
Okay. And how would you categorize your skin? Do you think your skin is more normal, dry combination? How would you categorize it?
I would say normal.
Okay.
Dry areas.
So normal to dry?
Mm-hmm.
Where do you think you're the most dry?
My forehead, believe it or not.
Okay. And what leads you to believe that your forehead is really dry? Do you flake or?
No, it just feels dry. When I put my moisturizer on, that seems to absorb more.
Okay. So you're not necessarily flaky up there or
No.
anything like that. Okay. Any place else where you feel like you're more on the dry side?
Perhaps my nasal area.
Okay. And what makes you think that's dry?
I will get sometimes flaky areas in that.
Okay. And so, just as an aside, it's not uncommon whether you have dry skin or oily skin to get sometimes flaky in this area, and some people actually get flaky in their eyebrows, and they think their skin is really dry. I've even seen men from time to time that have really large bushy eyebrows, and it almost looks like they have dandruff in them, and actually that can be a little bit of contact dermatitis or seborrhea that you can have checked out by your derm.
Yes.
But oftentimes when we get you going on the skincare system, that clears up. And you don't get shiny at all in the T-zone?
No.
Okay. Does your skin feel less dry now that it's the summertime?
No, I don't see a change in that.
Okay. Were you ever a smoker?
No.
Okay.
Well, does smoking count?
Does what count?
No, I was never a smoker.
Good. Okay. And how about sunbathing? Were you ever a sunbather?
Oh, yes.
Okay. And at what point? As a teenager or as an adult?
Yes, probably from about 13 all the way up to my 30s, actually.
We were actually kind of joking about this when we first sat down, and we were saying about using sunscreen and baby oil and iodine,
Yes.
cocoa butter,
Oh my
those kinds of
gosh.
things. And what about, did you ever have acne as a teenager?
Minimal.
Okay, when you say minimum, you did break out occasionally?
Yes, around the time of my,
Okay. Okay, let's talk about what do you wash with in the morning?
I use soap and water.
Okay. Any particular kind of soap?
Yes, I use the Dove.
Okay. What do you do after you wash?
My niece sells Mary Kay products,
Okay.
so to help her out,
Mhm.
I've been using that product. So it's just a day cream, sunscreen.
So is the sunscreen in the day cream?
No, they're two separate.
Okay. So you use a day cream that's what for dry skin? And then a Mary Kay sunscreen. And
Yes.
what is the SPF on the sunscreen? Do you know?
Yes, 20.
SPF 20. Okay. And then at night, do you do the same thing, just soap and water?
Mm-hmm.
Okay. And then what do you use after you clean at night?
I use the nighttime cream.
So the Mary Kay night cream.
Yes.
And anything that you do after that? Okay. And do you ever use like any kind of a scrub or a mask or anything on an occasional basis?
Occasionally, I do have it. I maybe use it maybe once a month, not.
And it is a
It's a
scrub.
Mary Kay exfoliant.
Okay. So it's just kind of a granular type of.
Yes.
Okay. Okay. So where do we begin? Let's talk about some of these issues. So really what we're talking about is skin rejuvenation. Skin rejuvenation, you've heard me say this before, is a term that really encompasses a lot of different common concerns. So lots of times when we think of skin rejuvenation, we think of fine lines and wrinkles. And really skin rejuvenation is, you might have discoloration, you might have fine lines and wrinkles, but you might have texture issues. Maybe the skin looks dull, it doesn't look as translucent. Some people have mild to moderate acne, they have rosacea. So it's all the common superficial skin concerns we want to either improve, we want to hopefully, most people like to erase them, but we can at least improve them, the appearance of them, and that we want our skin to just look healthy, we want it to look glowing, we want it to look translucent, etc. And so when we look at that, we kind of put it into two categories. So, or maybe even three categories. So category one is sun exposure. Now, most of what we see in our lifetime in terms of sun exposure, and it's probably 90 to 95% of what we perceive as inevitable aging. You look in the mirror and you say, oh, I'm starting to look older, but everybody does. 90 to 95% of that is from sun exposure, most of which happened before the age of 10. And we have at least 50% of it programmed into our DNA by the age of 20. It takes 10, 20, 30, 40 years to show up. And a lot of times people really don't see much of anything in their 20s or even their 30s. And then all of a sudden one day they look in the mirror. And one of the common comments I get is people will say, well, I woke up one morning and it looked like somebody took the air out of my face. Or I just started all of a sudden seeing these fine lines or discoloration. And once it starts, it really gains momentum. And it's because it takes all that time to show up, and it's really been programmed into your DNA all this time. So that's one aspect. Now the second aspect is what we call, and that's extrinsic aging. So intrinsic aging is kind of the aging process that happens if you lived in a cave, you never had sun exposure, what happens to the face? So for example, gets kind of depressing, but for example, by the age of 60, roughly 80% of all females will lose what is known as the show of upper teeth. If you look at mom or grandma, oftentimes unless they're smiling broadly, you'll see the lower teeth more than the upper teeth. And the upper lip actually elongates this way, and then the platysma muscle pulls down and takes the corners of the mouth with it. Everything elongates, even earlobes, about 1/4 centimeter in men and a little bit less in women. And then a lot of times people say, oh, your nose keeps growing. Well, that's really not true. But if you have a prominent nose, it can actually droop and it can broaden through the base. We also see things that happen as loss of volume, which I'll get to in just a moment. But in women, we're challenged for another reason. We have the most feminine aspect of the female face is the cheek area, and particularly the apple of the cheek. So when you look at fashion magazines, not only are high cheekbones prized because they photograph well, but they're distinctly feminine. As we age, the cheek pads begin to move down, and as they move down, this area flattens. You start to see a nasolabial fold, and there's something that we refer to as a youthful triangle. So the youthful triangle is where the widest, highest part of the face is the cheekbone area, and it narrows into a nice defined jawline. As we age and we lose volume, you can literally turn that triangle upside down because this area becomes flatter and more narrow. This area becomes the widest and it becomes bulkier. And you probably heard this before. Have you ever heard, well, somebody who's been married for 30 or 40 years, and you say, oh yeah, they've been married so long, they start to look alike.
Right.
It's because the female face becomes more masculinized. Now, there's some things that you can do for the appearance of that to some extent, but that's really where cosmetic surgery comes in. And skincare, unfortunately, doesn't replace cosmetic surgery, but cosmetic surgery doesn't give you good skin. So in cosmetic surgery, they can put cheek pads back up and they can realign areas of the face and they can reposition fat and all of that. Now, within intrinsic aging, there's also what we call loss of volume. And it's estimated that even as much as 50% of what we perceive as that intrinsic aging has to do with loss of volume. And volume is primarily defined by hyaluronic acid. In terms of aging, there's one common denominator among all species, and it doesn't matter whether you're a human, you're a bug, you're a horse, and it is actually loss of connective tissue. So in a sense, we're all shrinking to death. And again, have you ever heard the saying, little old people? So we refer to them because we're shrinking. And it's not just bone mass, but you lose volume. When a baby is born, one of the reasons they're so fat, they're really not fat. You know, have you ever seen even a baby who's a preemie, or a baby who maybe the doctor says the baby's a little underweight, but they still look so fat because they're so full of hyaluronic acid. And hyaluronic acid gives you volume. It's one of the main constituents or main factors for having volume and having, you know, just that softness and that bulk to the face. It makes you fluffy. And when you get into your 20s and 30s, you lose hyaluronic acid, primarily due to the aging process, due to sun exposure, hormonal levels drop. And so that plays a major role. So these are all the issues that, you know, you kind of have to take into consideration when you're talking about skin rejuvenation. So here's what we're going to do for you today. Number one, I'm going to put you on our skincare management system, and I'm going to put you on the one for normal combination skin, even though you tend to be more on the dry side. And the reason is because this is so much more hydration than what you're using. Now, what happens is that this has to do with why sometimes people aren't necessarily quite as dry as they think they are. The outside of your skin, the layer that we touch, is known as the stratum corneum, and it's dead. And you shed about 500 million cells a day, but they're microscopic. You're not aware of it. Now, as we begin to age, and the longer that we age, these cells tend to stay on the surface longer. And what they do is they harden and they cornify, and they give that sensation of having dry, tight skin. And also, they can actually absorb any oil coming from your follicles. So even sometimes when people tend to be a little bit more combination or on the oily side, they don't realize it because it's absorbed by all this dead, dry skin. Now, when you wash your face, what happens is temporarily, when you first wet it down and you wash it, you go, oh, it kind of feels kind of nice. But then, as soon as the water evaporates, those cells shrink up because you've done nothing to get them off the surface. Now, occasionally when you do an exfoliant, that is going to take away some of those dead, dry cells. The problem with exfoliants that are granulated is that the granules don't know the difference between your dead skin and your live skin. And so sometimes they create inflammation or microscopic tears in the skin. That's why a lot of derms don't like those kinds of exfoliants. And part of the aging process, or really one of the main aspects of the aging process, is that it's an inflammatory process. And so things that create inflammation, we want to avoid that. So we do want to really resurface the skin. This is so critical because the more we resurface your skin, the more luminous it's going to look. You're going to be able to see your fine lines and wrinkles will look far less noticeable. And the skin just takes on this really nice glow. And also, when you do a lot of resurfacing and those cells are able to turn over more rapidly, it encourages a lot of other functions that can help your skin to look a lot tighter, a lot smoother, just looks younger looking. So the skincare management system has some ingredients in here. Primarily, one of the primary things that it contains for resurfacing is a combination of glycolic, salicylic, and azelaic acid. So that's going to be really critical because it also brightens the appearance of skin. It just makes it look so much softer and smoother, and it works very, very quickly. Now, there's a lot of other elements in the skincare management system that help to address the appearance of aging. Okay? Then, here's what we want to do, and you probably won't start this right away, but I'm going to include this.
Okay.
So when your skin acclimates, we'll start this, and this is something called Marini Luminate. Everybody over the age of 35, 100% of the population will have abnormal pigment. Now, even if you look in the mirror and you don't say, oh, gee, I have obvious brown spots, there's something called background pigment. So look at a picture of yourself or somebody when they were 20 or 25. Look at them when they're 35 or 40. The difference in terms of just how translucent your skin was, the clarity of the skin, it changes. Mm-hmm. So this is a huge issue, pigmentation, because in studies where they observe individuals, pictures of individuals, and guess their age, we think that the defining factor would be fine lines and wrinkles. But actually, people with pigmentation are oftentimes guessed to be older than individuals that have fine lines and wrinkles. So the other thing that's in here is retinol. There's more medical data on retinol and glycolic acid than virtually any other topical agent for helping with the appearance of aging. So it's really, really critical. And if you go to our website, you can see some very dramatic before and after pictures with some of these topical agents. I also am going to include the Marini Luminant Eye Gel. And there's probably some things that we're going to do as we go along. So here's typically how this is going to roll. So usually what we do is I check back with you in about 4 days, and then we'll check back with you in 2 weeks. And we're going to continue to work with you because your program may need to be modified. Now, typically 9 times out of 10, or 99.9% of the time, the program is really just exactly what you need. But seasons change, your lifestyle changes. Mm-hmm. So from time to time, you need to modify your program. And also, there are things that we can do that can continue to assist with skin rejuvenation. So even if you said to me a month from now, wow, my skin's the best it's ever looked, I can get it to look better. Mm-hmm. I believe it. So, do you have any questions for me?
You're very knowledgeable. I thought I was smart.
Oh, thank you.
So I learned a lot from you today, so thank you. Just for the skincare and the...
That's very kind of you. Thank you. You know, one of the reasons that I do this and that I'm so passionate about it is because I really want to educate people. Oh, yes. And you know, when you go on the internet or you go to a department store, it's so seductive because nobody ever tells you they have the second best product. Everybody's got the latest, the greatest, the most incredible technology. And oftentimes we buy things or we're very confused, but we might even purchase something because even though it's non-specific, it's just supposed to make us look better. It's supposed to make us look younger. But how? And you really have to approach it from the perspective of what is it I want to change or improve? And then what is it that I'm going to use topically that actually can make a difference, that have some medical validation behind it? So that's what I would like all of you that are listening to also take that approach.
Yes.
Anything else that I can answer for you?
I'm looking forward to see what transpires.
Oh, well, thank you. I'm excited too.
Yes.
Well, thank you so much for watching. Please subscribe, and I'll see you again later. Bye.